Hello, and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that's dedicated to providing you with practical and useful information regarding mental health issues and needs. Suicide ranks as the third leading cause of death for young people ages 15 to 24. Here to help us understand more about this serious problem and what we can do about it is Henry Westray, who is head of suicide prevention for the state of Maryland. Hello and welcome to Mental Health Matters, Henry.
It's great to be here, Edgar.
Let's start off by talking about how significant suicide is as a problem in this country, say as related to the problem of homicide.
You know, it's interesting because people hear about all the homicide deaths and it makes the news and everybody's afraid in their communities and feel that we need to do something, and have done a lot in terms of homicide prevention, in terms of communities mobilizing. But when you look at homicide and compare it to suicide, every year we have something like 29,000 suicides in this country, as compared to 19,000 homicides. So you have more suicides than you do homicides in this country.
So why is it then that homicides make the news so frequently? They're often headline stories, while suicides are still kind of kept in the back, in the closet.
Well, I think a lot of times people are afraid to talk about this issue, and sometimes people themselves have thought about suicide, and they see it as a mental health issue that affects somebody else a lot of times, you know, and other families. And by talking about it, some people feel that you may be sanctioning it, that it may happen. But the reality is if we don't talk about it and we don't talk about solutions, we can't reduce the number of suicides, particularly among youth. Youth in this country, 15 to 24, have the third largest group in terms of suicides.
Well, let's talk about some of the risk factors. I mean, as you and I have talked many times, and even off camera today, we know that suicide is a very complex issue. It's a very complex problem with multiple factors, but we do know that there are some groups that seem to especially be at risk. And can we talk a little bit about that?
Sure. Actually, when you look at white community, basically the white elderly, particularly elderly males, white males, have a higher rate of suicide. We're seeing significant increases in Native American communities. Not only are we seeing alcohol abuse that's very high in Native American communities, but we're also seeing suicide deaths related, particularly youth who have been adopted. You know, it's interesting. Yeah, you know, who have been adopted by white families outside of their tribes, outside of their tribes. In fact, I mean, there's a law now that kids who are on reservations can't be adopted out transracially, because they were having so many problems adjusting with those families in terms of their understanding who they were and the way of handling the pressures and working with, you know, living with a white family for a Native American kid. One of the things they've been doing is self-injury. So we're beginning to see significant increases in Native American communities. African American males as well. We have seen significant increases, although we're finally seeing it go down now, fortunately. African American females, one of the lowest groups in terms of, you rarely see a suicide among African American.
Well, let me stop you for a minute, because I remember when the story hit the newspapers, both in terms of the Washington Post and then the Sun, talking about the data that came back that the Center for Disease Control had really collected over 10 years, talking about this tremendous rise in suicide among young African American males.
Exactly.
And can you talk a little bit about that and some of what might be involved in that, because that was rather startling.
Yeah, the interesting thing about that is that we don't know much about it.
Okay.
You know, some research is saying it's African American youth who are in inner cities who have poor opportunities and depressed communities. Other research is saying the opposite. It's middle-class families who live in the suburbs who feel disconnected and are committing suicide. We don't know. We need more research to kind of answer those questions. But what we have seen is an increase in suicides among that group.
Well, one of the things that I wondered about, and it really struck me, is I think that we're both aware that there have been for a long time some myths that black folks don't kill themselves, and that in fact is really a myth. We know that there have always been suicides in African American communities just like other communities. What's the myth about? Where's that come from?
Dr. Alvin Poussant, we had who's a psychiatrist and who has done a lot of work with the Cosby Show, as well as deal with a lot of issues around suicide. And in fact, he has a book talking about African American suicide. And he gives a scenario of a black man on a hill, and the black man jumps off the hill to his death. And then when the investigators come, they say, well, he must have fallen, because the stereotype is that blacks are happy-go-lucky, or that they don't commit suicide. In reality, we do, and we have seen, as you're saying, in the last few years, increases in African-American male suicide. And one thing, hopelessness, depression, I think that in our communities we have a lot of undiagnosed depression. Anger, helplessness, lack of supports, lack of opportunities, racism. All of those factors, I think, contribute to African-American suicides in our communities.
Well, let's talk a little bit about some of the things that seem to cut across all cultural groups. When we start to think about issues having to do with risk, what are some of the things that you would think are important in terms of contributing to someone perhaps being in a suicidal crisis?
Contributing in terms of being in a suicidal crisis, I think depression, is a major factor in terms of suicides, particularly among adults. With young people, you do see more situational. I mean, you see depression, but you'll see more situational depressions where, let's say, if a breakup of a relationship, and the young man's girlfriend leaves him, and he doesn't know how to handle it, and his way of handling it is to commit suicide. Loss, I think, is a major factor, particularly someone close. With very young boys, what we tend to see is a loss of a parent. So typically they will begin to commit suicide. Going back to African American suicide, I did want to say that I believe victim-precipitated homicides, in terms of the high rate of homicides in the African American community, I believe some of those are suicides. Victim-precipitated homicides, that's where someone puts themselves in a situation for someone else to kill them. It may look like it's a homicide, but in reality, oftentimes, they may have said, I won't be living much longer, or I'm going to go out in a blaze, I'm going to go out as a warrior. And then they may pull a gun on a policeman with the empty bullets in the gun, or they may provoke someone else in some kind of altercation to kill them. So
for whatever reasons, they're not able to take their own lives, but they will set themselves up for someone else to murder them.
Exactly. And it won't be counted as a suicide. It'll be counted as a homicide. Or you may see someone in a car accident where there's no skid marks, meaning that they never stopped, they never hit the brakes. It may be counted as a car accident. Or you may see overdoses where it's the person may actually know the amount of drug that would kill them, and and then when it's investigated, they say, oh, it's just an overdose.
But what this kind of information gets at is that suicide is even more of a significant problem than we recognize, because you're indicating that many things that will ultimately be officially classified as accidental deaths are in fact situations where people intended to take their lives and did so.
Exactly.
One of the other things that occurs to me also in terms of things not being counted as suicides is the whole issue of life insurance, and we recognize that there are policies that will not pay
It's true.
the loved ones, will not pay the heirs if the person is seen as taking their own life. So there are a number of prohibitions, and you and I have also, of course, talked about in some groups, and cultural groups and religious and so forth, you won't be able to be buried. Or so there are lots and lots of reasons that we want to kind of stay away from this. But I mean, I think as you point out in terms of the data that you share, it continues to be a problem for us much more than the homicides that make the newspaper every day. So this is something that we really need to focus on. Let's start out by talking a little bit about what we're doing. How can we help? How can we intervene? What's the state doing?
Oh, I'm glad you asked that question. I've been very fortunate to be in a job where I felt that we are affecting people's lives. In our state, we have had school programs. Actually, the first programs in our state were started by the Department of Education in setting up school programs, and each school district received funding to begin to develop. In fact, in Maryland law, school districts are required to have suicide prevention programs, which was wonderful, I felt. Some 15 years ago, the governor started a group I chair called the Governor's Interagency Work Group, which is overseeing suicide prevention in terms of Maryland. And one of the major things we did is to set up something called the Maryland Youth Crisis Hotline, which is the first decentralized hotline in the country. And that's been up for maybe about 11 years. Why it's so unique is that it combines about 6 hotlines that are part of the hotline network. And if you call that number, and I'll hopefully give that number several times.
Yes, you will.
It automatically relays you electronically to the center that's closest from where you're calling, all over the state. So there are about 6 centers that are a part of that network. I meet with that network for the past 11 years for every month, to coordinate services, and it's been a phenomenal help in terms of catching kids young people who are in crises. Also, we find adults called as well who want information about about suicide prevention or other issues that their teens may be facing.
So this service then is available 24 hours a day to assist people. Can you give our viewers that number now? 1-800-422-00.
Okay, all of a sudden I forget the number. 1-800-422-0009.
Okay. We're going to take a short break, and then we'll come back to talk more about what the state is doing, the projects that you're involved with, and how folks can help people who are in a suicidal crisis. Thank you. We'll be right back.
In our nation of plenty, 1 in 5 children faces hunger every day. America's Second Harvest feeds 23 million people every year. 9 million are children. Help feed a hungry child. Volunteer at a food bank or pantry. Organize a food drive at your school or place of work. Get your friends and co-workers involved. Visit secondharvest.org to find out how you can help. Together, we can end hunger in America.
I am a walking, talking miracle.
I am here because I survived leukemia,
lymphoma, Hodgkin's disease, myeloma.
I'm here because of my strength,
my faith,
my treatments.
I'm here because of you.
Thanks to support for the Leukemia and Lymphoma Society, the survival rate for these cancers has nearly doubled in the last 40 years. Please help us keep the research going. Call 1-888-HELP-LLS.
I am a walking, talking miracle.
I am here because of you.
Bachelor number 1, how would you advise me to structure my investment portfolio?
I would say be cautious and invest in government bonds, money markets, and CD accounts.
Bachelor number 2,
I'd say it's your age to invest fully in high-yield stock.
and bachelor number 3.
I'd diversify your investments. It would make your overall portfolio more balanced and can minimize your risk.
Okay, there you go. Now it's time for you to make a date.
Bachelor number 3.
Bachelor number 3.
Remember, make a date today to diversify your portfolio and choose to save.
Welcome back to Mental Health Matters. We're joined today by Henry Westray,